Next up is the pretracheal fascia. It covers the front of the trachea. Okay, so the pretracheal fascia, it covers the front of the trachea and the sides of the trachea. It splits to enclose the thyroid gland. Okay, it split and see, as you can see here, see. This here is the pretracheal fascia. Okay, as you can see, this is the pretracheal fascia. This is enclosing the thyroid gland. Okay, so the pretracheal fascia, it is enclosing thyroid gland. It is arising from the sides of the trachea. That is where the pretracheal fascia is. Okay, see here, this is the trachea, and now this is enclosing the thyroid gland, as you can see in this diagram. Okay, wait. Okay, so next is covers front of the trachea and sides of the trachea. It splits to include thyroid gland. Okay, forming its capsule and is attached to the oblique line of thyroid cartilage and arches of cricoid cartilage anteriorly. So as you can see, it is attached to the oblique line of thyroid cartilage. It is attached to thyroid cartilage and the cricoid cartilage also. Okay, it is attached, but I think I did not draw that. The one which is attached to the cricoid cartilage, that is called ligament of Berry actually. So here it is attached. This is cricoid cartilage. That is also called ligament of Berry. And then we trace it horizontally. It merges with the investing layer of deep cervical fascia. Okay, so when we are vertically tracing it upwards, it joins with thyroid. Below, it joins with fibrous pericardium in vertical tracing, whereas in horizontal tracing it merges with the deep cervical fascia. Okay, now the pretracheal fascia is attached to the hyoid bone, thyroid and cricoid cartilage, as I have told. So hence these things, they move up and down during deglutition, okay, along with the larynx. Next is the prevertebral fascia. It forms the floor of the posterior triangle and forms axillary sheath up to the elbow. Okay, it is continuous as the axillary sheath up to the elbow, and it forms the floor of the posterior triangle. It encloses longest colli muscle. Okay, vertically it encloses longest colli muscle, and this is the features of prevertebral fascia. Okay, and the other features, I'd see, this is the vertebra, this is the prevertebral fascia, and between them is the prevertebral space. Okay, prevertebral space. Okay, and then this is the buccopharyngeal fascia and the wall of the pharynx. So between this wall of the pharynx and the fascia lies the retropharyngeal space. Okay, retropharyngeal space. Buccopharyngeal fascia and the prevertebral fascia lies the retropharyngeal fascia, which has a median fibers fusion in between. Hence it divides it into two spaces of Gillette. Okay, spaces of Gillette. And the other derivatives of this fascia are carotid sheath and buccopharyngeal fascia. Buccopharyngeal fascia is the facial modification of pharynx, which is present in the wall of the pharynx. And carotid sheath, as you can see the you need to draw this diagram. The contents of the carotid sheath are, see, this is carotid artery, common carotid artery. Then there is internal jugular vein. Superiorly, its relations are superiorly it is related to ansa cervicalis, inferiorly it is related to sympathetic chain, and the carotid sheath, it is wedged between the three layers. See, this is the pretracheal layer, this is the investing layer of deep fascia, and this is the prevertebral layer. Between this is it is embedded, it is wedged between them. And then I have talked about the contents. Vagus nerve is also there, and at the arch of the aorta, as it reaches the arch of the aorta, it blends with tunica adventitia of arch of aorta. Superiorly it is related to ansa cervicalis, inferiorly it is related to sympathetic chain. This can be asked as a spotter question also, and then you need to remember this diagram. Okay, thank you.